This conference will now be recorded.
Next. So, congratulate my students of 5th year Mainamoti Medical College. I again pray to Almighty God for healthy life of my students and for their faithful life with continuing medical education and preparation for ensuring final topic examination. Today we will discuss regarding the next 5 questions of cardiovascular system. And in the last Saturday, we have discussed 5 questions of cardiovascular system, and today we will discuss from question number 6. A 60 years old male person presented with history of syncope. On examination, pulse is 36 beats per minute and regular in rhythm. So question is, what is your clinical diagnosis? Our clinical diagnosis is Stokes-Adam attack due to complete heart block. Stokes-Adam attack due to complete heart block. Our second question was, what other clinical findings you will find when examination of this patient? Regarding findings, the symptoms of the patients are dizziness, loss of consciousness, and convulsion, which is very transient. And sign pulse rate is 36 beats per minute, rhythm regular, high volume pulse, variable intensity of the first heart sound, cold calm skin, pale face. And next question was, what are the possible causes of this condition? And the causes of complete heart block or of this condition is MI, ischemic heart disease, some drugs like beta blocker and digoxin. Now question number 7. A 60 years male presented with exertional dyspnea and bipedal edema. First question is, mention 2 important differential diagnosis. And the differential diagnosis are congestive cardiac failure and clot pulmonary. And how we'll investigate this patient? Among the investigation, first investigation will be ECG, where you can get LVH that is detected by S in V1 and R in V6 more than 35 millimeter. And in case of RVH, R in V1 is greater than S in V6. And other investigations are X-ray test, which can show cardiomegaly in case of LVH and emphysema change in case of pulmonary. And in emphysema change of the X-ray heart will be tubular in shape, wide intercostal space, hypertranslucent lung field, and low flat diaphragm. And echo can show LVH, RVH, and ejection fraction may be reduced, and valvular orifice may be changed due to valvular heart disease. Now the complications of the chronic heart failure. First complication is CRM. Second is hyponatremia and hypokalemia due to diuretics, especially furosemide, and hyperkalemia due to ACE inhibitor, hypotension due to diuretics, and thromboembolism due to prolonged immobilization of the patient, and cardiac arrhythmia, atrial fibrillation, and your ectopic ventricular ectopics may be present. Now question number 8. A 35 years old male has recently diagnosed with hypertension. What history and clinical examination you will do for this patient? Regarding history of this patient, we will take the history of hypertension, family history of hypertension. Second, the patient may have headache due to increased pressure in the upper arm, and weakness in the lower limbs due to decreased blood pressure in the lower limb in coarctation of the aorta, palpitation, sweating due to pheochromocytoma, and weight gain and cold intolerance in case of hypothyroidism, increased sweating, palpitation, and heart failure due to thyrotoxicosis. Regarding the clinical examination, pulse radiofrequency delay may be present in case of coarctation of the aorta, exophthalmos, lead lag, lead retraction in thyrotoxicosis, renal bruit in case of renal artery stenosis, moon phase in Cushing syndrome, and palpable bilateral kidney in adult polycystic kidney disease. Regarding the investigation of this patient for hypothyroidism, THS will increase and T4 will be decreased. For renal artery stenosis, ultrasonography of the kidney shows small size kidney on the affected site, and CT angiogram of the renal artery to confirm the stenosis, and serum creatinine may increase. For coarctation of the aorta, X-ray chest will show notching of the ribs, and ECG will show LVH, echo confirmed diagnosis. For pheochromocytoma, 24 hours urinary metanephrine and non-metanephrine increased, and CT scan of the kidney and suprarenal gland may show adrenal tumor. Dexamethasone suppression test for Cushing syndrome. Now the 4 first-line antihypertensive drugs. First one is ARB. Among the ARB, losartan, potassium, and valsartan, and the side effects dry cough, hyperkalemia. Second drug is ACE inhibitor, ramipril, lisinopril, and side effects is same. Cardioselective beta blocker, atenolol, bisoprolol, metoprolol, it produces bradycardia. Calcium channel blocker, amlodipine, and it produces peripheral edema. Now question number 9. What do you mean by stable angina? Stable angina is caused by transient myocardial ischemia and is characterized by retroesternal chest pain or discomfort in chest, which increased after exertion and relieved by taking rest. Among the investigation of this patient, flat or inverted TOF in lead 2-3 ABF or B1 to B6. ST depression is another important sign of your ischemic heart disease. ETT to detect ischemia due to stress condition. Lipid profile, serum cholesterol increase, triglyceride also increased. Blood sugar to exclude diabetes mellitus. Coronary angiogram to know the nature and extent of the coronary artery disease, and with a view to CABG and PCI. Advice to this patient, dietary advice, low fatty diet and take green leafy vegetables and fruits, no extra dietary salt. Smoking should be avoided, physical exercise, regular walking at least 30 minutes daily. Weight reduction, diabetes and hypertension should be controlled by diet. And this is the last question of cardiovascular system. A 12 years girl presented to you with fever, anorexia, palpitation, large joint pain. She gave history of sore throat 3 weeks back. What is your diagnosis? Our diagnosis is a rheumatic fever with carditis. And second question was, write down the clinical feature of your diagnosis. Symptom of this patient: history of sore throat 3 weeks back, painful swelling of the large joints of the lower limbs and upper limbs, which is splitting in nature. Fever present, palpitation due to carditis present. And regarding sign, flattening arthritis of knee, ankle and elbow joints, and palpitation due to carditis. Loud is first heart sound, and mid systolic murmur due to valvulitis. That is mitral valvular inflammation. And diagnostic criteria: arthritis and carditis. And our last question is, how will you treat this patient? And treatment of the acute attack: bed rest of the patient and till joint pain subside. And sore throat will be treated by tablet phenoxymethyl penicillin 250 milligram 6 hourly for 10 days, or injection benzyl penicillin 1.2 million or 10 lakhs unit IM single dose. For joint pain, tablet aspirin 60 milligram per kg per day in 6 divided doses till ESR come to normal. Tablet prednisolone 1 milligram per kg body weight till ESR normal. And indication of prednisolone is if pain not relieved by taking aspirin. For prophylaxis, secondary prophylaxis, tablet phenoxymethyl penicillin 250 milligram 12 hourly for 5 years. Or up to 42 years for carditis, or injection benzyl penicillin 10 lakhs IM monthly up to 40 years of age. And that is the end of the today's class, as well as ending of the question answer session of cardiovascular system. So we have completed respiratory system and cardiovascular system. 20 question total, 10 question from respiratory and 10 question from your cardiovascular system. And in the next Saturday, we'll discuss if our Almighty God bless us to continue the class. And we'll discuss regarding the nervous system question of Chennai University for exam. So thank you, my students, and I again pray to Almighty God for the healthy life of my students and for their continued medical preparation for coming exam in November. Thank you all.
Thank you,
Thank you, sir.